As state senator, I saw the healthcare system on a state level. As first selectman, I saw the healthcare system from a local level. About 20% of Weston's budget, perhaps a little higher, 22%, is healthcare costs for the town employees of the town of Weston. As a self-employed attorney with one secretary, one other attorney in my office, when I started practicing law, it was not common for law firms in this area to provide health insurance for anybody. Well, secretaries certainly not, but not even for the attorneys. It was just unheard of. And now it's grown to the point where if you don't provide it to your secretaries, to your attorneys, you're probably not going to have very good attorneys or very good secretaries or any kind of secretary. So I had a young secretary who was 19 years old, and she is a terrific secretary. She's still with me now. But she came to me and said, look, I need health insurance or I can't work here, but I prefer to work for you. I have also seen it from the point of view of, practicing 41 years of law is very different than running a restaurant, because the vast majority of people at Cobb's Mill who work for us are Hispanic. They are all legally in the United States, but the vast majority of them do not have health insurance on their own. In fact, I'm not sure that any of them do. For us to provide health insurance to them would bankrupt us. We would be out of business. It would just be prohibitively expensive. There is no silver bullet for this. I guess if I had the solution to all of this, I'd be the President of the United States, because even he or she or whoever it is has not been able to solve that. I will throw in one thing, though, that and you're going to think this is very odd for an attorney to say. There needs to be massive tort reform in this state, all 50 states, probably imposed from a federal level. The awards that are granted and in courts which drive the insurance premiums for doctors is just out of sight. It's ridiculous. The whole health care cost system has got to become less expensive than it is. I don't think that can be done on a private basis. That needs some sort of government assistance in order to get there. We've got to do something about this. I know that, for example, between the time that I was 22 when I first got married until I was 55, I get a state of Connecticut health pension now because I spent several years as legislative commissioner. My wife and my 4 children had no health insurance, and we were just plain lucky that nothing serious occurred. The worst that happened was my 4 children were born, and I paid for it in cash out of my pocket. But had there been a major medical problem, I would have lost everything that I had built myself. There are 2 ways to go bankrupt in this country. One is to get divorced, and the other one is to become ill. You can save for a lifetime and lose it in a heartbeat. It's absolutely ridiculous. If there was a way for employers to provide health insurance at a very reasonable cost to their employees, they would provide it. But I cannot provide health insurance at the rates that they're at now to 20 full-time employees in Cobb's Mill. It's just prohibitively expensive. Something's got to be done about it. I leave it up to all of you to decide what that is. Perhaps if Connecticut could devise a system, it could be a model for the country. Thank you.